how I work, I would say that people come to me, the story is almost always things were better, things aren't so good, we know we need some help, and we have no idea where to begin. So sometimes the people who call me are elders, actually this crowd's pretty young, that are like in their, probably most of my clients are late 70s, 80s, 90s, or their family. So we're talking again about that sandwich generation that many people have parents they're taking care of, step parents they're taking care of, blended families, or it may also be that somebody calls with something that's a chronic illness, that's a younger person. Maybe somebody that has an ongoing, maybe like cerebral palsy, or maybe I have a client who has schizophrenia, trying to see how we can help those people. What I do at that time, how that process looks, is that I usually meet with families for a couple of hours. And I like to meet with whomever will meet with me. So if it can be the elder themselves, I'm going to talk about the client as the elder, or the whole family, or a caregiver, or sometimes it's just the concerned neighbor or the concerned child that meets with me. And I do a real comprehensive verbal assessment, and that's kind of what we're going to talk about tonight. I'm going to kind of walk you through my process, and for you to be able to figure out what's important when you're dealing with yourselves or looking ahead or trying to help somebody else. What are some of the things that you want to think about in looking at somebody's situation? So I like to look at, you have a handout there. It's a one page, I think everybody got it, and at the top it says, creating the roadmap for your journey, Eldercare, the art of living and aging well. Did everybody get one? Do we have some, Siri? And this is just for you to kind of jot down notes as you go through and see if there's something that you want to remember. But the areas that I like to look at, and so I'm looking at medical history, and we'll spend more time on this. I like to look at what's been going on and what medications somebody's on, what their health history is. It doesn't have to be a big written history. It's just a verbal history of what's going on. It's really surprising. A lot of times people will come in and they'll say, I don't have anything going on. And then I'll have this list of 15 medications that are all heart medications and blood pressure medications and depression medications. And so that helps me to figure out just what kind of things we're dealing with. The second category there is cognitive or memory or behavior. And this is just a most important category. Sometimes I wonder whether I should put it at the end because it makes everybody nervous. You can have the best plans in the universe, and if your memory fails you, it's a new game. Everything else can be working, and if your memory isn't working, it's a new game. There are so many things we can do to help that, or to put things in place that make things work more smoothly. So that's really an area we'll talk about. Functional capabilities are everything that I see, how people live at home, are they able to bathe, how do they toilet, how do they sleep, what's their nutrition, what's their balance, what's their pain, do they have hearing loss, have they had a vision check, do they have, what are their vision and hearing, I just said. And speech is in that, and I put on next to speech choking. Sometimes one of the first things that you'll notice with somebody who's having some difficulties is they have choking episodes, and that is actually a speech therapy challenge, so that's why that's there. Housing plan and choices. We can talk about this as much as you want to. So many people, when they get to be older, if they haven't already made that decision, it's just such an uncomfortable decision for a lot of people to leave their homes. But it's a big conversation to have, and people can certainly stay at home. But if you need support, and eventually probably most people do need some support, to look at what that looks like and get enough support in place in the beginning so that it will actually be a successful plan. We'll talk a fair amount more about that and about the differences of assisted living, life care, that kind of facility. Financial and legal, of course, financial that's pretty important, and that has to do with what your other choices are. But just because you don't have a big pot of money doesn't mean that we can't come up with some good choices. So you don't have to be too nervous about that. Legal considerations takes in making sure that you have a trust if you need it, or a will, or you might need a special needs trust for someone. We'll talk about that. Socialization, supportive, your support, activity, companionship, those things are all so important, and especially when we find people whose health is declining. It's often people find themselves in a real isolation. So taking a look at that, having a talk about that, and seeing what are some of the choices. Transportation's huge. Nobody wants to stop driving. That might be one of the #1 things that people tend not to tell the truth about how they're doing because they're so nervous that somebody's going to take their car away. We'll look at that. And then the last one is building a team, and you're the leader. As you go through and think of this, we all really need a team. We have a team now. At whatever age we're at, we either have teachers, and we usually have a doctor, and we might have a pharmacist, and we have somebody at the grocery store, and all kinds of, we just need a team, and you need to continue to do that. I'm going to read, my goal for tonight is for you to take away the idea that there is probably some simple intervention to add quality to the life of you or someone you know. I'd encourage you to kind of think, if whatever we're talking about doesn't fit you, instead of kind of thinking, oh, this isn't, I'm 30 years away from that, to kind of go back and think, how can you remember some of these things, or make some notes, or to watch for them as you get down the way. I would venture to say all of us know somebody who's having some challenges in this area. And whether that's your neighbor, whether it's somebody you just kind of know, whether you're actually a caregiver, all of the things that we talk about can fit in at any level. I'm open to questions. We'll have time at the end for questions, so if you feel like you want to wait and we can talk about whatever you want to talk about. If there's something that's a burning desire as we go along, then yes.
Were there more of those sheets?
Yes. Did you have, yes.
3 up here.
Oh.
Thank you, excuse me. I'll bring some out.
Okay, do you still have some?
We're out, but I will make some.
Oh, I might have some. Okay, you're going to get some? Okay. And my philosophy, that is, everyone that comes really deserves a really great assessment by a professional to determine what's working and what's not working. I think one of the things that I offer, and your other professionals offer also, is to know to ask the next right question. So you can present with what's going on, and sadly, even sometimes, a lot of times, you go to your doctors, and I go to doctors with a lot of people, and we present whatever the main thing is, but there's seldom questions then to ask the next thing that's going on. You have to be your own best advocate, because in today's world, the doctors just do not have time. There are some that are fabulous and kind of pick out what it is that you want to talk about. But primarily you go in for an appointment, and they really want to stick to what you've made that appointment for. So it's important as you go through to kind of think, what's the next, what else is this meaning besides what it just looks like? I like to think also care management might be a new, have any of you heard of care managers before? that care management is kind of a new buzzword. I started out calling myself an RN eldercare consultant, and then a lot of people didn't like the word elder, but I decided that's, that's what we are. And but I'm also a certified care manager, so in the new Affordable Care Act, care management is a big piece of what's going to help the systems to work. If you've got oversight of somebody, that you're actually looking at what's going on and catching it before it turns into a bigger problem, getting people into their primary care physicians and taking care of small problems, that's how we're going to save money as a country, and that's definitely how you're going to have a better quality of life as you go forward. What I'm going to do right now is I'm going to read you a case study of a care management example, and this will show you kind of how a care manager thinks, or how it might make a difference. Sarah, you don't have to remember the specifics of this, that it flows, so don't worry about specifics. Sarah, an 84-year-old woman, lives alone in her own home. Her only child lives 50 miles away. Sarah's husband of 60 years passed away 9 months ago. Until recently, Sarah has been an active member at the senior center in her neighborhood. She's been driving herself to activities. Sarah's daughter recently visited for several days and was concerned because upon arrival she discovers that her mother has had 2 fender benders in the past month, is not going to the activity center, has a bruise over her left eye and reports falling twice, does not want to go out for lunch or shopping, and has outdated and moldy food in her refrigerator. Sarah's daughter assumes this recent decline is probably a normal process of aging, something to be expected. My orientation as an RN eldercare consultant and certified geriatric care manager is that all of the changes Sarah is experiencing need to be evaluated and a plan created that will reverse the decline. Now, we might do this plan and might find out that all of these things, that Sarah really is on the road down, and then we need to support her in that also. But in this case, after an appointment with her primary care physician to rule out any acute causes for these changes, such as a stroke or something like that, we created a plan that included support from a peer-to-peer counselor from the Alliance on Aging. This is a free service. We'll talk about it a little later. A driving evaluation from a specialist, and transportation for Sarah that included our new ITN service and an inexpensive senior taxi vouchers. Excuse me. We'll talk about that later too. A physical therapy evaluation ordered by Sarah's doctor and paid by Medicare, and 3 months of personal trainer support to build her strength. A companion twice weekly to befriend, observe, prepare tasty meals, and accompany Sarah and her dog on additional walks, and extra funds available because Sarah's husband was a veteran. 3 months later, Sarah returned to her independent, with support self. With proactive planning, living long can definitely be a blessing. So you can see, if we get a few things in place, that we can really make a difference here. I'm interested to know, maybe a show of hands, or maybe if you want to tell me, is what your basic reason for being here tonight. Are most of you looking for just plans for yourself down the way? Do you have somebody in your life who you're concerned about and really want specific information right now? Just general information? Anybody want to?
For me, it's for my mother and then for myself too.
Okay.
What things are available.
Great.
Resources.
Great.
I want to know what's available for me from down the road.
Okay.
Yeah.
Okay. Okay.
So I worked through it already with my dad, who's no longer here, but now my mother is a prime candidate. In so many ways, she's set up for independent living, but emotionally isn't ready. And then I also manage people's money, so I have clients who I want to be on top right direction or make sure that they have resources.
Terrific. Those are all things we'll cover. Let's see. I'll start with, there's a quote from Rosalind Carter. She says that some of us think, oh, why are we here? And is this something that we need to spend our Monday evening doing? She says there are only 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who need caregivers. So I think it's pretty apparent that we all need to have the information about how we can help ourselves or help those around us as we go forward. The challenge of aging does not have a lot to do with chronological age, but rather with those areas of a person's life at any age that are not working. Those could be pain, cancer treatment symptoms, balance issues, accidents. So it doesn't necessarily have to be a big, huge change in life to be doing something that we can come in and really make a change on maybe just one small area, and so that you get back to your normal way of being and are able to live independently. My expertise, I would say, is in the assessment, both the initial and ongoing, making the assessment, seeing what's working, what's not, making a plan, and coming up with resources. Then I like to feed out to resources. I think one of the best things of using somebody like me is that you cut to the chase, or through the chase. That you don't have to go to the yellow pages and call all of the different resources and then find out why you were so unhappy. So my goal is for you to be educated so that you're able to make those calls, and that you're able to go to the doctor, and that you're able to do these things and really advocate for yourselves or the people around you who have to be or need your advocation. Also, always keep asking the right question, and I encourage you to be that same way, to be curious. I have a really, really good friend and they're really, she and her husband, they're really smart. And right now in this time, she's been in the hospital about 3 or 4 times. She's been to, she's really having some challenges, and she's 72. And she goes to the cardiologist, and then she goes to the nephrologist, and she goes to the emergency room, and she passes out, and everybody's telling her something different. And I said, why don't you go to Stanford? Why don't you go get a really good assessment? And she says, well, I can't, because how would my husband take care of the dogs and everything that's going on? So, sometimes we just aren't thinking that when nothing's working, or when you've been to the doctors and you've been to the good doctors and you feel like you've gotten referred and it's still not working, think about a referral to someplace else. You can go to any medical center in the nation, and usually you can self-refer. It's probably better to go through your physician, but your Medicare or most insurances will pay for that. So you don't have to stay just where you are. Keep being your own best advocate. Keep looking when improvement is not adequate. So if you go to the doctor, or whoever you're with goes to the doctor, and they give you a treatment to try, and whoever you're with goes home and refuses to do it, or you go home and do it and it doesn't work, that doctor is not going to call you back and say, how's it going? They're going to assume that everything's working, unless you call them back and say, this isn't working, or my mom's refusing to do it. What else could we do? So you want to continue to look and be, again, I'm going to keep just drumming it in, be your own best advocate. Coordinate a care team. Have more people than yourself on the care team. A lot of people use me. I will do that initial assessment, and then I may not see people for weeks, months, sometimes years. But when something comes up, they'll call and they'll say, this is going on now, and I can say, either we should have an appointment, or what, have you tried this, or why don't you ask this question, or whatever. So develop your team and then know who they are. A pharmacist is one of your best friends, and our friend Brian Illinois back there, you probably all know Brian. but he is magical in knowing about medications and treatments and natural treatments. And so many of the people come in with these lists of medications, really 11, 15, 20, yeah. And maybe they need to be on some. I'm not one to say that we have to take everything away, but I would say most of the time when I go to a first visit with a physician, with a person who has a fair number of medications, we can get those cut in about half. And if you are working with somebody who that isn't their expertise, which a lot of the physicians, it might not be their expertise, use your pharmacist, even the pharmacist at your regular drugstore. That's what they do. And if you find that the one you go to isn't all that great, go to another one. We can give you some names. That tonight we'll continue to have a conversation about how you can be the best, your best advocate. I'm going to I'm going to start here with going through what I would consider on the evaluation. Hang on just a second here. Actually, I'm going to start with telling you a story. This is a story, this could go into our transportation time, but we'll start with it right here. As a senior citizen was driving down the freeway, his car phone rang. Answering, which he shouldn't have done, he heard his wife's voice urgently warning him, "Herman, I just heard on the news that there's a car going the wrong way on Interstate 77. As a senior citizen was driving down the freeway, his car, oh, I'm sorry. It's me. Please be careful. Heck, said Herman, it's not just one car, it's hundreds of them. So watch out for Herman. Okay, here, just a second. So we're going to look at kind of how to go through this assessment a little bit. So starting with medical, I would encourage you to look at, make a list for yourselves and have this of what are your diagnoses, or the person you're dealing with. What are their diagnoses? Their heart disease, joint problems, knee replacements, thyroid, either too much thyroid, too little thyroid. Usually it'll be too little. Kind of go through all of that, then look at the medications and see how everything works together. Look at the person's body. That, is there swelling of the legs? Do joints hurt? Do toes hurt? Is there something that we can do to just make somebody more comfortable? We're going to talk a little bit more about that. But that first thing is to get everything in order so you're not missing what's going on. When I was in nursing school, we really learned, to start from head to toe and just think about everything there is. Start with your hair, start with your face. Before I go in for my yearly physical with my doctor, I kind of sit with myself for a few minutes and think, what's hurting, or what's been there, what's going on, so that you can really have a good story about yourself and who else there that you're dealing with. Memory is and cognition, behavior, those all kind of fall together, and they can be so tricky. I just actually came from a client today that there's a couple, and the gentleman, they're 78 and 84, and the gentleman has been diagnosed with early Alzheimer's, and it's probably moderate Alzheimer's. So we all know that he has some challenges and can kind of take care of those. The wife, who's high functioning and has some more physical challenges, is very resistant to anything we're talking about. And history has her as being kind of a resistant person to some things. But a year ago, she was much more self-reliant, much more able to do the things that she's doing. She's very, very tricky to figure out. Is she having some challenges with her memory? Is she unable to do these things we're wanting her to do? Or has she always just not wanted anybody to tell her what to do, which a lot of my clients don't like that I tell them what would be good for them to do. And so we try to make that a little softer. But that early memory loss is really a challenge for all of us. In my opinion, and the Alzheimer's Association, they're the guru of memory loss, whether it's Alzheimer's or whether it's from another cause. They're the ones who are doing the studies. They're the ones who have the information. So the Alzheimer's Association is really a good place to kind of check in with their information. But they say if you look, it looks like you have memory loss. And a sidebar of that is, if you've never thought somebody had memory loss before, you know, 5 years ago they were functioning perfectly fine, and you've never thought you had memory loss before, 5 years ago you were perfectly fine, and now the people around you are saying you're not doing things the way you used to do them, and it seems like something's going on, but we don't know what it is. It might be that you've got a little memory loss, or however that, it's not just memory, it's also what we call executive function. So the smarter someone is, the more highly educated they are, the better they've been able to function in life, the better they can usually cover. And just like all of us are drivers, probably, if you're not a driver, that's okay, and or walkers. And so if we go to the end of the block and, you know, there's a detour sign or whatever, we can figure out how to get around it. So we've got lots of different ways to do this. A person who has kind of lived their life like that, they can do that in the same way with when they start to have memory decline. So it is tricky. And so families and professionals, we say, well, you know, maybe it's us. Maybe they are okay. Maybe it's just me. Maybe they're just cranky. Maybe it's me who, you know, that I really am picking on them too much. The only way you're going to know is to have a really good assessment. So the Alzheimer's Association says when you think there might be memory decline, a person should see, probably you start with your primary care physician, and the primary care physician may do a little memory test. And that may or may not come back normal, and you may or may not have some cognitive decline. You should have an evaluation with a neurologist, and the neurologist is there to rule out that anything else is going on. It's really a rare circumstance that there's a tumor or something else that's going on that's causing cognitive decline or memory loss, but it's not so rare that we shouldn't all have that looked at. They run a few lab tests that are recommended. Thyroid's recommended, B12's recommended, and I cannot for the life of me think of the next one. Do you know, Brian?
I would run a CRP just to see what their state of inflammation is.
Absolutely, yes. So you want a really good assessment. So I have been to several of these also. And even the neurologist does a pretty simple screening test. And sometimes people who you just will swear up and down, something's wrong here, they come out smelling pretty much like a rose. At that point, what you want to ask for is a comprehensive cognitive evaluation. And it isn't for everybody, and I'll tell you who it's not for, but it's definitely for people who are fairly high functioning, who are still living independently or somewhat living independently, who we just can't figure out what's going on. For these people who are in their, at whatever age they are, they have a fair amount of money, they've always managed their money, all of a sudden they're making some mistakes with their money, and by golly, they are not going to let you, their son or daughter, come in and help with this. Um, we need to find out, are they able to do this, or are they not able to do this? So comprehensive cognitive eval is done by a neuropsychiatrist or a neuropsychologist. Oftentimes it's a team. You can self-refer. Again, they'll actually, I think you need to have the doctor do it, but you need to just ask your doctor. You can refer up to a medical center. Stanford does a great evaluation. My favorite, I love UCSF. They do great evaluations. It takes probably 3 to 6 months to get in. It's amazing how fast those 3 to 6 months go. And Medicare will pay for it. You can also, we have a wonderful neuropsychologist here at CHOMP, at their behavioral health over on Hartnell, across from the library, or from the post office. Her name is Verdette Brum. She's a young woman with wonderful credentials. She graduated from UCLA and USC. And so you can also go there, you get a referral, go in for an eval or for an initial appointment, and then come back, and it's about a 4 to 6 hour evaluation. So obviously this is a lot of good information. There too, Medicare will cover that. We also have a couple of people in town who are neuropsychologists who work independently. I'm going to throw out one name because she does such a great job, is Dr. Trish McKeon. And she's great for certain people, and she is private pay. So if you're going to do something like this, it probably comes out to be somewhere between $1,000 and $1,500. But if you've got a person, I have her working with a client right now who's very, very difficult, won't let us do anything, won't go to an appointment, has a little agoraphobia, and definitely has some probably mental illness diagnoses along with just memory loss. Dr. McKeon is able to go in and do this assessment in her home and give us the information we need. This is the same kind of information that you would need if a person needed to be conserved. We can talk a little about being conserved. Let me just think if I've gone through what I want to go through on that. I wanted to just back up a minute. On the evaluation, everybody doesn't need it. So if you've got an elder parent, anybody, yourself, they've got pretty significant dementia. They're all set up. They're not a behavior problem. They kind of go along with whatever you tell them to do. They may be at home with caregivers, or they may be at an assisted living, and there aren't really any problems. They don't need this big evaluation. If you've got a mom or dad or somebody who's living in their own home and you're totally confused about what is going on and are they safe and do they need 24-hour care, or do they just need somebody to come in and give their medicines, or are they going to burn the house down, they need this assessment. What comes out of it, it's also sometimes called a functional assessment. What comes out is what's this person able to do? Are they able to call 911 if there was an emergency? Are they going to go outside at night and not know where they are? Some people are no wander risk at all. They're never going to go out the front door. Sometimes they're not able to go out the front door. They don't have that much mobility, but they have enough mobility to get to get to the bathroom, and that they would probably be able to call 911. So all of those are different scenarios that you might need a more significant evaluation. There are other resources that are for people with memory loss. Health Project Center, also known as Del Mar. If any of you are dealing with somebody that has memory loss and you need more support, they are a county agency. They are free. They are fabulous. You can call them. They will meet with you. They are for the caregiver. They're not for the person that has the a brain disorder. So brain disorder can be memory loss. It could also be a traumatic brain injury from a car accident. It could be a young person. It could be a drug overdose. It could be any number of things. Anybody with brain impairment. They offer classes. They have had some money for respite care, but they're a great resource. One of the things that also goes along with that we want to rule out with memory loss and cognitive challenges are depression. Many older people have depression, loneliness, sadness. I find a lot of times if I ask people, do you think you're depressed? Oh, no, I'm not depressed. And you know, they are not depressed and they don't like that word. And sometimes if I can get around it a little bit differently, that they'll at least talk with me. We can do a psychologist for some therapy, and that also gets raised eyebrows, you know, oh my gosh, I'm not going to talk to anybody. If I can sometimes get somebody in there to talk with them that they don't even quite realize it's a psychologist and they think, oh, this person was wonderful, then we can get the whole process going. Medicare will pay for some counseling. They will pay for a LCSW, a licensed clinical social worker, and they will pay for a licensed psychologist. All of those people don't accept Medicare, but we do have a fair number in our community who do. In that same category, sometimes a psychiatrist is a necessary referral. That we oftentimes see behavior challenges that come along with memory loss. I believe that there are a lot of people who begin to have memory loss or something that looks like Alzheimer's. It could be Alzheimer's, it could be something else, it could be vascular disease where you're just not getting enough oxygen to your brain. It doesn't really matter what it is. It matters in some areas, but in any case, you're dealing with the challenges of somebody not having a good memory. I just forgot what I was going to say there too. It was really important. I'll come back to it. Hearing loss can also really complicate memory. That if I've seen this so many times, hearing loss in elders is not only volume, and we all then yell at them and whatever, so they just can't hear. And you're yelling at them. But a lot of times it's that they can't understand the words. And so it's a brain thing. You really want to have an excellent hearing evaluation with an excellent audiologist. And there are some that are better than others. And there are probably some that are really outstanding. And I just haven't worked with them and don't know. So yours may be great. If a person has hearing loss, there's special telephones that are free, offered by the state. And sometimes somebody with either hearing loss or with memory loss, and they can't remember the numbers, they can't make the phone calls. We've got telephones that we can put some, the three kids' pictures on or whatever, and you can dial just by that picture, which is great. An opposite problem of that with I know what I was going to say, psychiatric diagnoses, but I'll come back to it. Help me remember. An opposite problem of that is that people sometimes with memory loss call and call and call and call and call. And you may get 20 messages from them in a day. I sometimes say, consider a separate telephone, put an answering message on that telephone. They call, they get it. It's, hi, Mom, thank you for calling. I know we're going to do this today, and just have a nice message, and I'll talk to you later, and that's it. And they may not even realize they're not talking to you. The psychiatric challenges, a lot of times you'll see behavior challenges. I believe that a lot of people in their elder years probably already had psychiatric illness throughout their lives and nobody picked it up. So in today's world, we recognize some of those things. We take people to the doctor, we know about bipolar, we know about severe depression, we know about all kinds of things. There was a time that nobody treated any of this, and a lot of times the history will be, my mom's always been difficult. You know, she's always yelled and screamed and done this and whatever. So then you're dealing now with somebody who also has memory loss and they can't remember their coping mechanisms. So maybe through life they have just come to this edge. They've usually been pretty socially acceptable because they would pull themselves back just at the right time or not, or go back and apologize. Now they're not able to do that anymore. So if you recognize that, again, you want a memory evaluation, but you might also want a psychiatric evaluation. And believe me, every psychiatrist is not a psychiatrist is not a psychiatrist. Would you agree with me, Brian? So there are some that are excellent at this, and some are private pay, and some are great at managing medications. Everybody doesn't need medications. Some people really do need medications, and they do so much better. Just as a side note, for community hospital behavioral health, again, they have great psychiatrists, and you usually don't see the psychiatrist. If you're on Medicare, you usually don't see the psychiatrist frequently on an ongoing basis. So your primary care physician can refer you to a psychiatrist at a community hospital, and that's fine. It may be exactly what you need. You'll go in, you'll have an evaluation. You may see them 1 or 2 more times, or you may not. They may start medication, and then they will send that person back to the primary care physician to manage. That may be fine. If you've got somebody who's really complicated, you may want to ask about some other possibilities. We have some other people that are excellent, and sometimes it's pretty costly, and that's not in your budget. Hearing loss, vision, should have routine vision checks after age 65. There's a few things, macular degeneration in particular. There's wet and there's dry, and one of them, I believe it's wet, causes blindness. Dry, you can probably get through. But it's very important to find these things early. We have a wonderful blind and visually impaired center in Pacific Grove. You can go there if you have a diagnosis, and probably even if you don't. They have resources. They have magnifying glasses. They have screens you can put on your, magnifying screens you can put on your computer, all kinds of things. They're a great resource. Dental health, consider really doing your dental health as you always have, and your elder also. A lot of times we let that go, and I think later, I see so many of my clients in their 80s, 90s, they are unable to do very good dental health. They may need some help. Sometimes they're able to use like a Sonicare brush or something, and they can really do better with that. But frequent, probably 4 times a year, if it's not too upsetting for them, dentists at that time. You're going to have a workshop on inflammation coming up. Inflammation of your gums is one of the biggest things that causes problems. Sometimes a person might think, well, if if their memory's so bad and they don't know what's going on, and they're not having that great a quality of life anyway, why do we care? Well, we do care about comfort, so that's one of the things that we care about. But the other thing why it's important to do all of these things is because it's a person that is well taken care of is much easier to, or well maintained is much easier to take care of, and is a much lower cost than if we have to bring in more caregivers. So it is important to continue these things. Medication management, the best thing to do for medication for somebody who's unable to manage their meds, I believe, is to have the pharmacy bubble pack them. They can bubble pack like all of the morning medications in one slot. Sometimes you'll see that they put all of the different ones on a different card, and nobody likes making all of those punch outs. There's different pharmacies that will do it. I believe, and even though I can't get my husband to do it, and he's sitting back there, that if you are youngish and you're taking a lot of medications, you should start a system right now of an automatic dispenser, because if you're pulling your meds out of your bottles, I see everybody that if they have their system set up in the late 70s, 80s, and we try to change that system, they do not want to change it. And it is so easy to make medication errors. And medication errors are one of the big things that will really cause people to get into trouble. Pain management, I think pain management is huge. And one of the things that we're not still back on memory except how it fits into that, but pain management for everyone, I see a lot of people who will say, well, you know, I've had this backache forever and I just have to live with it. People have the choice to do that, but I really maintain that a better way to do is ask your doctor if you can get on a routine, simple pain medicine. Tylenol, ibuprofen, depends on what your other medical conditions are, whether you can do either any of those. Oftentimes, giving something 4 times a day will almost take away that pain, along with some movement exercise. There's also some really good medications that aren't narcotics, but if whatever you try isn't working, let us keep trying. There's patches. I think integrative is wonderful. There's nothing like exercise. You can get a physical therapy evaluation from your doctor, occupational therapy. Sometimes it's a matter of looking at what kind of chair you're sitting in or how you're standing. There are inexpensive places to go for treatments. The sports center is $38 a month. We belong to the sports center. They take it out of our checking account. There are, I think, 200 classes or 400 classes a month or whatever, that there just is no better thing you can do. I also work with some people who are private pay that go into homes and work with people on for pain management. Balance and pain really look a lot alike in this. They both have a lot of the same treatments. I work with a couple of not physical therapy, but personal trainer people, and they're more expensive. They're like probably $65, $85, $90 an hour and want to go in twice a week. A lot of people can afford that, or some people can afford that, and it works wonders for them. Massage therapy is wonderful. Warm water therapy. We have a wonderful pool both at the sports center and also Kearns Kearns Memorial Pool. I don't know, do all of you know about Kearns Pool? It's a wonderful facility that we have. It's over behind the Naval Postgraduate School. I believe it was built in like the 50s, and it's in a neighborhood. If you drive down the neighborhood, you don't even see it. It looks like it's a house. And it's warm water. They do therapies, and it's fairly reasonable cost. They don't take Medicare or Medi-Cal. Rides Bus will take people. They can work with people one-on-one. They work with everybody with disabilities, but I've had several clients who are I have had a few that were really advanced Alzheimer's that couldn't follow anything else. They could go in the water and they just loved it, but it's a wonderful resource that we have. On decreasing strength and balance, most of those things also go along with pain. I believe there's nothing you can do better for yourself or whomever than to keep yourself physically fit and to eat well. And those two things will keep you as healthy as you can be as you go forward. Home safety. You can evaluate your home pretty well, get bars in early. I just had this client who lives in a huge, magnificent home that could have anything in Pebble Beach. And she has really advanced memory loss, and she has 24-hour caregivers, and we've been wanting to put bars in there. So we were asking her about these bars, and she says, no, I'm not having anything, I'm not having any bars. So one day, we took her out to the movies, and we had the bars installed, and she never even noticed that the bars were there. So, you know, sometimes you just can do things without asking. That is okay. There's a section here about home safety. I work with a gentleman, I don't know if you know him, Brian, do you know Shane Buzza? There are other people, but he's put together a plan that he'll do a home safety plan for $150. Come in, really look at everything that's going on. At the stairs, the railings, do you need a ramp? Do you need bars? Where do you need them? Do you need a handheld shower? All of those things are safety features. The bars and getting up from the toilet, Another thing that's safety that I didn't mention is toileting. I always ask people about their toileting and, you know, are they incontinent, are they dribbling? And sometimes, you know, that's kind of a personal thing to ask. But it's a safety issue. If people are don't think they're going to make it to the bathroom and they're running to and dribbling, there's such a fall issue. So a simple thing to do is use a pad. Get a poise pad. Get just a pad so that if you don't make it, that all you have to do is change your pad. Personal. Oh yes.
What was the name of the home assessment person?
Shane Buzza, Buzzy, and if you don't, I believe his, what is his business? He has you might find him just on that, but if you just call me and ask me, I'll, or my email's there, I will give that to you.
Excuse me, Jen.
Yes,
Did you say that it was $150?
that is 100 for the evaluation.
Oh, just for the evaluation?
Yes, and then depending on what you need, if you have a contractor or even like Home Depot, you can call them. They'll come and put in bars, but then the person charges for whatever repairs that you need. He has somebody who will do that, or was that something, that little noise I just heard?
It was to remind you of that thing you forgot about.
Oh, I think I remembered it was, oh. Is that my phone? Oh, am I driving? Oh. Caregiver overwhelm. Are there any overwhelmed caregivers here tonight? Okay. Caregiver overwhelm is so huge. And people are so resistant to get the help they need. You will always be a better caregiver if you take care of yourself first. There are we didn't talk back about on memory. If somebody has early memory loss, there's a wonderful group at the Alzheimer's Association out at Ryan Ranch that meets on Thursdays. And the person with the early memory loss goes to a group with other people with early memory loss, and the caregiver or support person goes to another one. And I have had several people who have been in those groups and say they're just wonderful. If you're working with somebody who has more advanced challenges, then going to a support group on your own is probably better. There's some excellent ones. There's a list of all of them. Martin Scarrett has run a group at Chomp Behavioral Health for a very long time. He's a very gentle man, and a lot of people really like him. There's many others. Ann Albano runs a group at Carmel Foundation. She's great. I don't know, do you know of any others, Brian, that are in particular? Okay. And there's a book, or it would be on TAM. No, you probably, overwhelmed caregivers probably don't have time to read a book. But there is a book called The 36-Hour Day. It also is on, it's a CD, and I don't know if it's a video. It's by Nancy Mace, M-A-C-E, and I have not read the whole thing, and but people who have read it say that it's fabulous, and I need to do that. There is a Share the Care program. I'm not going to go into that much, but it is a program that was brought to our community, and this is really good for people who have a broad group of people in their lives. A younger person, or maybe a younger person taking care of an older person. I find that so many of my clients, no matter what their socialization was, if they're in their mid-80s and further on, they don't have much support group anymore. That even if they're pretty healthy, most of their friends are not, or they've gone to live with their kids. I often say, it seems like my clients and my colleagues' clients are pretty challenging. So we said we think the reason is that every forward-thinking person moved closest to their older daughter when they were 69, and so we don't ever see those. It was all the ones who didn't make any plan. But this Share the Care is a program that, if anybody's interested, it's gathering people together who maybe each do a small activity, and it's managed by an overseer. There are also online programs that work very well for people if you've got a family that's interested in setting that up, and maybe you've got several siblings or something, and everybody can go on and keep track of the elder on their own. Let's see, living environment. We'll talk about that. Disorganization, clutter. I know some people who are fabulous at cleaning out, helping you clean out, professional organizers, and it's pretty reasonable. Transportation. Oh, I wanted to talk a little bit. Are we doing okay? Is this the information you want? Is there anything that you're thinking, oh, I have a burning desire to know about and we haven't covered yet? I still have things, but are you okay? Okie doke. Transportation, big, huge area. Nobody wants to quit driving. And some people really need to quit driving. And sometimes you need to take the keys, and sometimes you need to disable the car. When somebody is diagnosed with, I can't remember, I don't think it's mild cognitive impairment, but I think it's probably the next step. The physicians are mandated to notify DMV about that, and still nothing always happens because people really don't care if they have a driver's license, and they really don't care if you told them they couldn't drive or they weren't safe. So sometimes that's not simple. For somebody who does care and that they are somewhat reasonable, or that you that we're able to, there is a program up at a Chomp. It used to be paid for by Medicare. It is not any longer. It's $500. The occupational therapy department will do a driving evaluation, and it is it's really worth the money for the right situation for somebody who you can't get them out of their car. They will go through all kinds of tests, and then it becomes an objective. You're not just telling your dad he can't drive anymore. They test reflexes, they test memory, they test all kinds of things. So sometimes the person will believe this and stop driving, but in my experience, the person this really helps is the family. The kids, the sons and daughters of people that really need to have people step in and make some changes for them are just so reluctant to do that. It's, they don't want to tell their parents what to do, and especially when they've got a parent who has always been powerful and they have no use for being told what to do. We have a new organization or the last few years. Are you familiar with the Independent Transportation Network? Anybody? Okay, so it is a nonprofit organization that came to town a few years ago. It's called ITN. They have volunteer drivers, and you pay to join. You pay, I believe it's $50 that you put in an account, and then you can call at any time and make a date for somebody to come and pick you up. Oh, you also put that $50 is membership, and then you put like maybe $100 in your account. So there's no money that exchanges. Or a son or daughter could set this up from somewhere else, or that could be a gift to give them for Christmas or something like that. That sometimes works. So all you Independent Transportation Network, ITN. The other thing we have, which I don't know how many people are using it, is our MST, the buses. They have a program where if you want to make an appointment, they will take a one-on-one to get on the bus, go with someone around the places they like to go. So maybe they want to go to their doctor's appointment, or maybe they want to know how to go to Del Monte Center, or maybe they want to go to the beach. They will ride with them, teach them that route, give them good maps, and practice with them. So there's lots of good choices. I think a really good thing to remember is start using this early. Legal, financial. Let's do financial. Should definitely have money looked at by, reviewed by your accountant or whoever has done that. A lot of people come in and they haven't seen the accountant or anybody for years. And so making sure that you have somebody who you trust, get a good recommendation from that. Have somebody look over everything. Again, if somebody is, we're looking at long-term care, especially with memory, we want to make sure there's enough money. Oh, yes, sir.
Just on that, on ongoing bills, like, utilities and stuff.
Mm-hmm. How do you do that?
Yeah.
There are people who pay bills. Your accountant will look at your big thing. I actually work with an the person who, and I know you can chime in if you'd like to. There are bill payers. There are bill payer companies, which I have a few people. There's also a few services that are really great if you have family feuds. So if you have a lot of people have blended families, so you've got stepchildren and both families have some money, and now as the old, or sometimes one family has money and the other one doesn't. I have seen a few times, daughters and mothers take care of each other better, and sometimes that's not always true. I've seen the other two. But so we'll have maybe a wife with money, the stepdad who came in and really doesn't have money. Sometimes they have it divided, sometimes they don't. And then you've got two sets of stepkids that are coming in. This is just big, huge red flags that you want somebody in there right away. And there are some outstanding people who do this kind of work. Cindy Healy is one of the ones that I think is, she's just marvelous on. There's others, but she does, I think her organization is called Financial Securities Incorporated, maybe. And, but she's great, and there's others, they just don't have them on the top of my mind right now, but that will really meet with people who there's kind of warring factions, so that we make sure that everything's taken care of well. Again, you want to look if this person's having memory loss, you want to be real careful about changing any documents, and it's amazing when there's no money, we don't have nearly as many of these problems as we do when there's a big estate. But if there's a big estate and you change documents and you've got stepchildren and children and all this, you can bet that somebody's going to come back and challenge it. So you just want to make sure that if there's a sticky situation, that you've really got the best people who know what they're doing. You may have the best attorney, the best financial people, but if this isn't their space of expertise, find somebody who is, and they'll work with your professional. Yes, sir.
Can I go back to Sarah?
Absolutely.
You mentioned there was a veteran's benefit for her that did
Yes.
something for her. Would you
Yes,
elaborate?
yes, I will, and that's the next thing. Let me do one more thing on legal. I want to talk just a second on special needs trusts. So they are so important. If you or somebody you know has a child or the elder themselves who is not going to be able to take care of themselves, this again, this is not somebody with a new Alzheimer's. I believe a special needs trust has to be developed before the person's 65. If I could be wrong, but I think that's right. So, yes.
Or the language can be in the trust or other legal documents, just as long as the provision's there.
Okay, good. And so what happens is, say you've got a good amount of money that you're going to leave your kids. You've got 3 kids. Actually, I have a case just like this. They had a good amount of money. They had 3 kids, or not too much money, and they had the third one was really a wayward kid and a drug addict and had never done anything quite like he was supposed to do forever. But they didn't want to leave him out of the situation. So this particular couple, they have passed away since, they divided their money by 3 and gave $500,000 to each of the 2 good kids, put $500,000 in an account that the wayward kid only gets the interest. So what has happened, and then that money is going to be divided amongst the grandchildren. Well, only one of the kids has grandchildren. So, I mean, this is really tricky. So what they've done, though, this gentleman who is the drug addict and whatever and is really in trouble right now and needs the money, by setting it up that way, he's going to just run into trouble that he's going to have probably too much money coming in each month that he's not going to qualify for state services. So you want to be very careful with a kid who is not going to be able to function for themselves, maybe a mentally handicapped, mentally challenged client. You want to make sure that you don't set them up so you keep them from getting state services, because they may really do well by having Medi-Cal services. And not only Medi-Cal will maybe pay long-term care, but they would also pay for them to be in the social service system where they can maybe get a care manager or a case manager. It doesn't mean they don't get this money, and it doesn't mean they don't get to use this money, but it's designated so that it can be used for certain things. So it can be used for care. Yes, and caregiving, for extra housing, for going on a trip, for all kinds of things. So just keep that in mind. Financial, you asked about the VA. VA aid and attendance is a wonderful benefit that people have. It is not, people get real confused with it. If you were a veteran and you were in the service just regularly, this is not the VA aid and attendance I'm talking about. You have access to VA, to Fort Ord. They have wonderful benefits. And I believe Lisa Horvath, who writes the article in the newspaper, just did an article last week. If you want more information on that, I can help you. But they've got great doctors, a great clinic. You can get your medications free out there. You can get all kinds of things. Depending on if you have disability or not, then there's other choices for you. And then also depending on if you have disability is if you're able to access like their skilled nursing. The VA aid and attendance is available for anyone who served 90 days or more, and we're not sure about the reserves, but in any of the times that were considered war times. So it was, I don't think there's any World War I's, World War II, Vietnam, the Desert War, Korea, and I believe the war now. And if you served 90 days or more, and there is a benefit that is about, it's somewhere between $1,200 and $2,000, depending on whether you have a partner or not. There's a woman in the area, her name's Lisa Clark, who actually works for a private company, but this piece of it is mandated by the government that they can't charge money or anything, but she's terrific she's the person you should go through and have her send you the papers and get this all done right. So oftentimes I'll have clients that are, maybe they have their Social Security, maybe the Social Security is $1,000, maybe they have some other money and maybe not, but they were a veteran and it will pay $1,500. All of a sudden, this $1,600 a month is a much better amount that we might be able to add some caregiving. That same benefit that you can get caregivers into the home, and there's some of the different caregiving companies that work with that. So it is a great benefit. Yes?
The point you made about the importance of the trust and having the words for special needs, that is such a critical need or issue, and it can be dealt with very simply by just making that a generic provision in any trust when it's being put together, so that should any of the beneficiaries become eligible at a future point for that special needs care requirement, the language is already there.
Are you telling me that? Is that right?
Yes.
I don't know that, so that's
Yes,
wonderful.
I know that.
Okay, that's wonderful. So, and again, you can have the best CPA, the best financial person, the best attorney, but if they're not dealing in what your challenge is, that you need to get an expert in that particular place. Medi-Cal is another one of those things. Sometimes, am I okay? Okay, is everybody okay? And we'll have time for a few questions. Medi-Cal, and I know, a lot of times people will sit and think, Medi-Cal, I'm not going to do Medi-Cal, that's people just taking advantage of the system. It's not just people taking advantage of the system. That oftentimes Medi-Cal is a really smart thing to think about, even if you have, I hear a lot of times, I'm not going to qualify for Medi-Cal, we have too much money. But where this really comes into play is if you're a married couple and one of you is really declining. And again, memory loss is a huge thing where you might be looking at 10 years from diagnosis or longer till somebody, till the end of life. So what you might want to do is meet with somebody who's a Medi-Cal attorney, and you want to look at, there's look-back periods, so you want to do this now so that maybe 5 years from now you will qualify. You want to make sure that your money, we want to make sure there's enough money for both of you. So we're not going to take all of the money. You're not going to cheat the state. You're not going to do anything like that. But without looking into this, it is not unheard of to have that one person use up all the money. And then all of a sudden, here you are, the wife or husband, who is fine and still has 15, 20 years longer to live. And you say, oh my gosh, they used up all the money and I have nothing. It's very important you look into this. And there are a few attorneys that are outstanding at looking at that. Long-term care insurance, if you're 60, 62, 65, I think long-term care insurance is wonderful. I've seen it made a huge difference for people. You can't get long-term care insurance once you have any kind of a health issue. You must have all of your advance directives filled out. Very important, no matter how old you are, your kids, your parents. You want to name a power of attorney for health and finances, and you want to say, what do you want to have happen if you pass out and your heart isn't beating and whatever. Most of us, that's not going to happen. The conversation is more important. So what do you want to have happen if you've been in the hospital 3 weeks and you're declining, and nobody knows quite what to do? Do you want to go to ICU? Do you want to have surgery? Do you want to have tubes? Do you want to have this? That's a more likely scenario for most of us. So it's not this cut and dry. Sometimes we say, I don't care what happens, just let the person who's making the decisions make it. It's too late then. So choosing not to do that, you're really putting a challenge on your family who has to make that decision. And choosing not to make that decision, you are choosing. So it's so important. Care management, that's something I do. And I would say in any complicated issue, consider care management. The first piece of that is sitting, having a conversation. This is the conversation we have. We look at every one of these situations. We see what's going on with you, what's not. Talk about what challenges there are, and talk about what possibilities there are. You can hire a care manager to just do that assessment. How I work, I can just do that assessment. I can write a report. I can write a really fancy report. I can stay with you and I can do everything for you, line all this up. I can, or you can do it all yourself, and you can call every so often and get another number. I'm happy to tell you I'm fee for service. I'm $120 an hour. Sometimes I like to say to people, when you've got a big situation going on, consider doing what you would do if you were healthy. You'd probably, or many people would consider going on a $5,000 trip, or maybe a $3,000 trip, or a $2,000. Maybe that's totally out of line, and that doesn't compute at all. But if you'll take that amount of money and get some of these services in place, I am a real believer that in 3 months, we know which direction you're going. So in 3 months, we either have you headed up with a great life and much less cost. Your biggest cost is always going to be caregivers. So if you head down, you're going to have more and more hours of caregivers. 24 hours of caregivers in your home with a company is between $12 and $15 and $18,000 a month. So few people can do that. It's much less expensive to do assisted living, and we can talk about that. I know we're close to time. I want to have a few questions, and I'm happy to talk a little bit more. If you wanted to talk about assisted living choices, we can do that. Or are there any questions or anything you wanted to hear and we didn't? Yes.
I am interested in assisted living choices, but and I don't know if this is appropriate for you, but I have a neighbor, and I am really concerned about this neighbor, and I just wonder what options I have to help her.
That's a good question. And is she, have you approached her, and has she been resistant to help?
I have not approached her about helping her because I don't want to alienate her. I worked with my sister who had Alzheimer's, and I went that route, and it's very difficult, and I do not want to alienate this lady, so I don't know which way to go with her. And it's not so much, I think she has a little bit of dementia, but she's in her 90s, so it's more that she just needs somebody to help take care of her.
Does she have family?
But she has a daughter who's close, but they don't get along, and she has a son that lives far away, and he calls once in a blue moon.
I would say,
She has a niece that also would like to help, and I did get her phone number, but is also afraid of alienating her, so that we said that she and I were gonna get together to try to figure out what we can do, but we don't really know what to do.
one of the things you might consider, and I mean, it doesn't have to be me, although I don't know anybody else who does what I do. Oh. But I mean, people do something similar to what I do, so it doesn't have to be me. But you could take my card if you wanted to and give it to her and ask if she would like to talk. I usually talk to people, or the niece maybe. I usually talk to people probably for about 20-25 minutes. People call me and we'll just talk about what's going on and see what is their need. Am I a person that they would be interested in meeting with? And then if they are, then we would make an appointment and I would go and talk with her.
So and you don't charge for the 20?
No, for the phone. And then the other thing that another choice would be that probably does a free assessment. There are care companies, if she was open to this. One of the really good care companies, and I should probably give you three, but I'm going to give you one, is Central Coast Senior Services. John O'Brien has been around the community forever, and they have stuff that falls through the cracks too. I'll give you two others. There's Victorian and Visiting Angels also, that do a pretty good job. But Central Coast Senior Services, if you called them, or if you wanted to call me and I could call them, they would come and do a visit. I think it would probably be free, and just talk about what kind of services are available, and they might be able to encourage her to have somebody come in once or twice a week, bring some meals, do some oversight, and then their care manager, they have good training, and they would have a caregiver, they call them personal attendants, who would come in and they would kind of oversee that. So that would be a very good possibility to get somebody in. So if she's kind of open, I think it's fine to say, I'm worried about you, and you seem really to be doing well, and but that there's, for when you might not be feeling so well, or if there was something going on, if we have these things in place, everything will go much more smoothly, and I'd like to help you do that. So, and see what she says. If you haven't asked her, you don't have to be the person who continues to make that happen. And if any of you are in a situation where you feel like you have this situation and you just really feel like it's unsafe, making a call to Adult Protective Services, you can do that anonymously, and they will check up. The program definitely has its faults. Definitely, the county services just don't have enough money. But if you make that call, they will check in and see. And going and finding a 90-something-year-old person by themselves, they will keep their eye on her a little bit.
Yeah, right, she's very afraid that somebody's gonna take her away from her home.
And I think to tell her also that the best chance of her not going away from her home is getting a little bit of help in there so people aren't worried about her. Nobody wants to take anybody away from their home.
Can I
So,
take 3 questions
Three-
to wrap up
yes.
quickly, and then you can stay after?
yes, absolutely. Yes,
I wanted to get at least 1 or 2 referrals from you about the long-term care.
insurance.
It's a really overwhelming topic.
I think Genworth is an excellent, Genworth is excellent, and I just heard I use usually Genworth. Yes, do you have
Can I
somebody?
just add, Genworth is a traditional where you pay for ineffective insurance premium to cover the risk if you might use it. Some people, the more contemporary is if you have a group of assets,
Uh-huh.
you can sequester. If they're needed, that's fine,
Mhm.
they go to that purpose with a multiplier effect. If they're not needed, they go to the beneficiaries. So they're two different
Which
approaches.
is great for people that have assets. And actually, even people who have assets, long-term care insurance is a great idea because, I mean, you can go through thousands and hundreds of thousands of dollars. I actually, I work with a woman, her name's Donna Brandt. She's with Primerica. Some people aren't crazy about Primerica, and I think she's very ethical. I also, I just heard of somebody, I can get you another name or two also, and if you call me. Anything else? Yes?
You mentioned a list of caregiver support groups. Is
Yes.
there an actual list?
Yes, there is, and the Alzheimer's Association would have that. I'm trying to figure out where I have mine. Are you online?
Yeah.
If you go online and go to the Alzheimer's Association, they have amazing information, and they will give that to you. Or if you want to email or call me, I'll be happy to email that to you. I'm going to say one thing about caregivers. I definitely believe you should go with a caregiver company. People sometimes hire by independently. If you're going to do that, you want to make sure that you have a contract that's drawn up by an attorney, and you want to make sure that you have insurance that covers them, and you take out their taxes and you pay their workman's comp. In California, we live in a state where caregivers cannot be independent contractors. No matter what kind of form you sign, no matter what anybody says, they are your employee. So if they're not an employee of somebody else, they're an employee of you. And your assets are totally liable if something happens. And that can even be after your demise. So believe me that they can say anything they'll say, and if you pull them down the stairs when you're falling and they have an injury, they will sue. So with that said, I believe you should do a caregiving company, and there are some companies that are better than other companies. There's several. Staying at home, people all tend to think, I want to stay at home forever. And sometimes that's a good thing, and sometimes it's not a good thing. I think when you have a significant memory loss, that might be a time that you want to look at assisted living. And one of the things, there's more than two, but there's large assisted living and there's small assisted living. So the large ones that you may know about are in our area are Park Lane, Sunrise, the Cottages. I think that's it, the big fancy ones. And then there's 3 that have been called either life care or community care. I'm not going to go into this too much, but Canterbury Woods, Forest Hill, and Carmel Valley Manor and Canterbury Woods have been life care. Canterbury Woods isn't anymore. So the only life care we have is Carmel Valley Manor. You pay a big chunk of money that you don't get back, and you pay monthly fees, which are probably somewhere between $3,000 and $5,000 a month. And they take care of you for the rest of your life. It doesn't matter. You are signed up and you are there. So you go in independently. You have to go in healthy. If you should need independent or need assisted living or need skilled nursing, you will stay there forever. And so that is available only for people who are really healthy. The Canterbury Woods and Forest Hill Manor both have something called continuing care. You also have to be healthy. They may or may not, they don't allow you to come in with a walker. You pay an amount of money for your apartment, and actually this is at Forest Hill, and then your estate gets most of that money back when you die. So you may get 95 or 90% back, depending how old you are. The reason that works is they've used your chunk of money, which is $100,000, and you haven't benefited by that, and they had. Again, you pay monthly fees, same category. They have lots of activities. It's a great social place. And if you need assisted living, you go to assisted living. And if you need skilled, you go to a skilled. But at each of those, the price raises. So you pay the market value at Forest Hill if you need that next level of care. Back at Carmel Valley Manor, you pay the same amount forever, no matter what kind of care you have. Canterbury Woods has just changed. They no longer have either one of those, and it has to do with they're going to be doing building in about 20 years, and they don't know what's going to happen. So anybody can go. It's a month-to-month contract, but you must be healthy. So they haven't changed their guidelines on that you can't go in needing assistance. Canterbury. And all of those are probably $3,000 to $5,000 a month. But that includes everything. It's not a bad deal. I just spoke with the person at Canterbury, and she said that most of their people that are coming in right now are in their late 60s. So, you go in there, you could rent out your regular house. That's all your utilities, all of your food, all of everything. So then the other big ones that we have are the cottages, Park Lane, and Sunrise. They all have a very different community feel. So why one would be right for you or not, you would just have to go visit. They all offer community living. They all offer a nice apartment. You would move in your things. We can get movers. We can get decorators. They all offer meals. They all offer activities. I think those are, and they all offer memory care units. They all have a secure memory unit. So if somebody is a wanderer or needs more care, they all offer care through end of life. So unless a person is a bad behavior challenge, that they're hurting other people or something like that, you could plan that you'd stay there for the rest of your life, and they're a month-to-month amount. And they're also somewhere between, you go in at 30 something when you start if you don't need any care, and they probably can go up to $10,000 if you need absolutely all care. You just have to need to check, and they have different prices, different things that are going on. Then there's a whole category of board and care that are also called assisted living. They're also called residential care. All of these are kind of the same. They're all licensed by the state a little bit. These smaller ones have either 6 or 8 beds, usually 6, and it's because the state has a licensing that comes in that. They also have a cutoff at 99. There's a few that have 99 beds. They're really nice. They're less expensive. Sometimes you can go in and stay for about $3,000 a month. You might even be able, there were a few that were in the low 2s. Who they're nice for is somebody who's more frail or has more challenges and really needs this small atmosphere. They're really not going to take advantage of all of the activities that you're paying for at one of the bigger places. One of the bigger places, you're in your own apartment. You're really behind closed doors, and even though they look pretty good, there's some challenges. These smaller places, and especially there's some that are outstanding, There's a caregiver all the time. I think it's important to look for a caregiver that they have an awake at night caregiver. Some of them still have sleeping caregivers at night, and I wouldn't have somebody go there. They build a little community. The challenge with them is you've only got 6 people. And depending on who those 6 people are or where their journey is, you or your loved one, it might not be an appropriate match. So you go in and everyone there is close to the end of their journey, and maybe 5 of them are really not having conversations because they have quite advanced dementia, and the other one is watching TV all the time or something. That might not be the right place for your person at this time. A different scenario, it might be the same facility, and you go in 6 months later, and all of those people that were at the end of their journey have journeyed on, and you've got a whole set of people that are much higher functioning. It might be perfect to come in. Somebody can make a friend, and it's just a perfect little place. So all of them have a different character. I love to go with people and help them look at these, and you can see there's just a lot of different things to think about, or that's something you can come in and we can talk about why something might be a great choice. There's a few bigger ones. Del Monte down on David is a little bit bigger, and Ave Maria has a little bit bigger, and they both do a great job. And I've seen different places that will keep people who run out of their money, and they'll keep them till the end of their life. Most people can stay there till the end of life. I'm trying to think if we've covered everything. You can go out, your family can take you out, you can stay in. Then the other level is skilled nursing. Most people aren't going to need skilled nursing. The one reason why so many people are in skilled nursing now is because the state, the Medicare, Medi-Cal programs, which are known as Medicaid in other states, the only level of care they'll pay for now is a skilled. Sometimes people think, oh, well, I just won't save any money and I won't make any plan, because if I don't have anywhere to go, I'll run out, use up my money, and I'll let the government take care of me, and I'll go to skilled. But what they don't realize is you have to qualify to go to skilled. You have to have a skilled need. So you can't just decide, oh, now I'm going to go there. You have to have something that you actually need, nurses and physical therapists and whatever. The other real challenge that's coming, I just heard there hasn't been a new skilled facility built, I thought they said in California, in 20 years, other than our little Forest Hill, which is all private pay. But Forest Hill is like $12,000 a month, which is beautiful. It's still a deal as opposed to keeping somebody at home. So if you have $12,000 a month, that's okay. One of the things you can consider doing too is, I sometimes think if you don't have a big pot of money, but you have some money, you could consider going, like, say, to one of the bigger places where while somebody's really more active, more alert, enjoying life, and using up more money over the next 3 or 5 years, and then say, you know, we're probably this disease is going to advance, that they're not going to get the good out of this facility. And at that time, you could consider moving to a smaller one that's definitely less expensive. So all of those things, all I can say is everything changes, and as soon as you figure out anything, it will change. So just staying on top of it, and there's just so many choices that we can do, and I think that's it.